Thank you, Bev. So now we have Brian Mason, the leader of the Alberta New Democratic Party. Brian, would you come to the microphone, please?
Thanks very much, and it's great to be here. It's great to see so many people coming. We've had lots of meetings in this room in the NDP, and this is the first time that people have had to be standing outside listening to what we have to say, and I'm really pleased that people have taken the time. And I think people have taken the time because this is such a critical issue. And we keep going down this road. We keep going down the road of the provincial government trying to foist a private healthcare system on us. In this case, the first step is to create chaos within the system, and then they will rush to the rescue with the magic solution, which is more private healthcare delivery. Well, we know how that movie ends, and it's not a happy sign, not a happy show. I want to talk a little bit about the politics of healthcare in Alberta. I want to talk about the fact that the Conservatives in the last election said not one word about their plans for our healthcare system. We looked carefully. There's just a couple of points in their platform document about healthcare, and nowhere does it say that we're going to cut healthcare. Nowhere does it say there's going to be a hiring freeze for nurses. Nowhere does it say we're going to turn the system upside down. Nowhere does it say that people, seniors and others who need care, won't be able to get it. Nowhere does it say that family members will have to give up their jobs in order to stay in hospitals and long-term care facilities to take care of their loved ones who aren't otherwise properly taken care of. I want to send a clear message. It's a political message. You cannot trust the progressive Conservatives with our public health care system. You can't trust them. And I've said in the legislature to Mr. Stelmach and Mr. Lethbridge, you have no mandate to do what you're doing because you didn't tell the people what you had in mind. Now, Ralph Klein, if you'll recall, did the same thing. I remember in that debate, the leaders' debate in 2005, I turned to him and I said, you have a secret plan to privatize our healthcare system. And he denied it. And yet it was only a matter of a few months, and we're in the middle of fighting the third way, which was certainly about public or private two-tier healthcare. You know, I want to just go over a few of the problems that we've seen. We've had and we've been hearing for months now about the nursing shortage. And yet the government's solution to the nursing shortage is a hiring freeze. It's absurd. You know, if it wasn't so tragic in its outcome, it would be funny. I want to talk a little bit more at length about the long-term care issue, because the government's strategy seems to be to convert long-term care beds into assisted living, which means that you don't get the level of care that you get, and you have to pay for everything. And it seems to me that that fits their vision better than providing long-term care. And we've really seen, I think, a real problem. They promised in the election, this is one of their promises, that they would build 600 new long-term care beds. And it's very clear from their strategy that they have released that they have no intention of doing so. In fact, they're converting or allowing the conversion of beds to assisted living. And it's not only tragic for our loved ones who can't get the proper care that they require, but it has other significant impacts on our healthcare system. One of the biggest problems we have now is a huge growth in average waiting times in emergency rooms. And in Edmonton and Calgary, the average waiting time is getting close to 24 hours in an emergency room. And it's growing here too. It's growing around the province. One of the main reasons for that is not a shortage of resources in the emergency room itself, but the fact that they can't move patients out once they've been stabilized to an acute care bed. The reason that they can't move them out into an acute care bed is because many acute care beds are filled with people who need long-term care but can't get a long-term care bed. And so the failure to deal with long-term care is producing a situation where everything backs up and people are dying in emergency rooms because they're not seen to in a timely fashion. Now the doctors are meeting, 700 doctors meeting just today in Calgary, and they said, it was clear that they are asserting that people are dying in emergency rooms because they are not being seen to in a timely fashion. This is unacceptable. And it's about healthcare costs too, because acute care beds are more expensive than long-term care beds. And so if you have lots of long-term care patients in acute care beds, your healthcare costs are higher than they need to be. So, you know, I find this to be one of the most damning indictments of this government's whole approach to healthcare, because the long-term care beds issue affects the entire healthcare system. Now, they do have a strategy for long-term care beds. They've approached the private sector to make up the